Thank you very much, Sami, and welcome everyone. A warm welcome in this cold weather, and thank you so much for coming. As Sami mentioned, my name is Weizi. You can call me Vicky. I'm a professor of informatics and digital health, and I'm also the director of the Future Blood Testing Network. It's a long name, Future Blood Testing for Inclusive Monitoring and Personalized Analytics. And we have been organizing this conference and a network for a few years, I think since 2020. So when the COVID started. And when the COVID started, I've been working with some colleagues, I think Hector, he will be coming soon. So to look at how can we monitor the blood and do blood testing at home. And then we come up with the idea, and we got people from different universities together and form up a network called Future Blood Testing Network. So for those, some of you might have already know our network. You have attended our conference before because we have organized a couple of conferences and webinars in the last 3 years. But for some of you for the first time, come to our network conference. So I just give you a quick introduction about what it's about in our network. So it's all about a new approach, a new digital health system that to support the blood monitoring at a non-clinical setting at home, and how to use the data in the blood monitoring and electronic health record, and to develop artificial intelligence and provide the personal analytics in AI. So you can see we have the 3 pillars in red: remote blood monitoring, ICT, AI, the personalized analytics, and we're also hoping to apply them in the exemplar clinical areas, immune disease, cancer, and also in the end benefit patient at a non-clinical setting. So we have a fantastic management team, and in addition to myself, we also have Rob sitting here, Mark, Jeremy, Serhi as management team, and we have Rachel and Sami as coordinator. So we have been running this network for more than 3 years, and we are founding consortium, have very good international consortium when we established it, and Kendall's here from Canada joined us as well. But now we have grown very big and across the world, across different countries in Asia, North America, and UK and Europe. And in our network over the 3 years, we have funded several projects. And the first project we funded is Dimitri's landscape report. So we have produced a landscape report about UK laboratory diagnosis, looking at the challenges, opportunities, and roadmap to have innovation for the blood monitoring and also the blood testing. And we are launching our landscape report today. So we will tell you later on how to view the landscape report from Dimitri, and Dimitri will also give you more details about what it's about and how you get information of this report. And also, we have funded several projects, feasibility studies in different areas, including AI and ICT, using the data to provide personalized support, and how to use remote monitoring and medical device for the disease detection and analyte measurement, as well as the treatment management as well. So we have a combination of developing medical device and point-of-care diagnostic device, including and also using the data and monitoring device as well, sensing technology. So bring them all together, having all the different feasibility studies. So we are currently supporting. And we are also very excited to see that apart from this small feasibility study we supported, there are also some larger consortium emerging from our network over the 3 years. Some example that the funding news has been embargo has been lifted, so I can put it on the slides now. So it's a EPSRC AI for Health project. Tony Bradlow and some other people in our team to look at using blood testing data and also other health data to predict inflammatory arthritis. And also on NIH grant, we've got to develop the product of using AI and blood test data to improve the referral triage. So we have quite a few people sitting here in this consortium and in this project. And another good news from Rob that we got another big grant about Advanced Diagnostic Center. So he will also mention later about the news, so can be a follow-up center, a hub of our network. So in total, for the external grant over the 3 years, I think we've got almost 10 million in over 3 years, and some other grant we are still waiting for the result. So hopefully we can get more and more follow-up funding in our research. Internationally, we are also being invited in many occasions, and we have been organizing the international conferencing system in US. We have organized 2 conference tracks last year and this year. Last year is about data blood monitoring, and this year about virtual hospital, led by Kendall as well. I've been invited by the network, been invited by Digital Health Conference organized by Stanford University, because they have established a Center for Digital Health. And we talk a lot about how AI can be used in the reality. And we're also part of the International Society of Digital Health. That is a big society, including people from Australia and from Hong Kong and from Canada, all together, representing the key challenges, looking at key challenges and opportunities in our area. So there are a lot of talks and a lot of synergies I found that when we meet all different people in the world and in the different team about the use of AI in the healthcare. That's why I think this year's conference theme should be digital health and AI. And what part of digital health AI? So I'll give you an example that there is specific focus, I think will be the future research direction. So I don't know if you have seen this image, this list. So someone has summarized all the artificial intelligence models published in the papers in a publication. So if you look at the landscape of all the clinical prediction models, there are so many of them. So if you look at the list, so for the COPD, you have 400 models. For cardiovascular, you have at least 300 models. For other disease mortality, 200 models. So there's so many models and AI application in the paper and in the literature. And do you think they are used? Are those clinical models being used? Okay, I don't find it. Yeah. So do you think if you think used, then I'll give you a number. So there is a very interesting paper saying that artificial intelligence in healthcare, a scoping review. So in 2021 alone, there are more than 10,000 papers published about AI in healthcare, but in that paper, only 50 paper is about formal implementation. So that means a lot of paper you publish the paper, a lot of AI model publishing the paper, but they are actually cannot be used. The usability and other things cannot make an impact in the clinical care. So a lot of so this has brought a lot of interest and a lot of the attention from all the different organizations, saying that calling for actions that artificial intelligence, not just the algorithm, and also need to implementing the implementation gap, bridging implementation gap of the machine learning. So a lot of factors like affecting the implementation of AI clinical context, and also are you using the right data, and do you have the right infrastructure? Have you talked to your end users and your monitoring? And the last decade, the researcher had been looking at the AI development and the retrospective evaluation. Well, the next decade, so the most of the research will be around the clinical usage of machine learning and the prospective trial, and really use how to use AI to make an impact. This has been echoed by EPSRC, the launcher called AI in Health to advance the usability of AI. New England Journal of Medicine now have an AI subjournal and really looking at the prospective trial of AI. Nature Medicine and also Alan Turing Institute as well as JAMA were all calling for action about the prospective usage of AI, and also using multiple data from multiple sites, not only in the one side, real world data in multiple sites. I will skip this. LM, so I was mentioning that, but if it's safe for use, but from my point of view, as a future blood testing, I always think the AI should be a good analogy with a medical device. It should be simple, robust, and lightweight and affordable, rather than very heavy, large models. We should aim to develop more light and also robust models for clinical use. Data, we have a lot of experts in data here. Multimodal data will be key challenges and key opportunities. And the data from different sources, from diverse population, we have experts here as well to talk about that. Personalization. And these are opportunities for multimodal data, but also challenges for the multimodal data. But how can we deploy our AI with heterogeneous data? So that's another challenges we need to solve. and fairness. I will make it faster. So, and fairness, health inequality, and another thing. So we have been talking about there will be the bias in the data because we have bias in the health system, and we will also have expert today to talk about the how to have a clinical fairness in our model. But another thing is that with the real world data, there is a chance that you might be able to develop more fair model. So there's a paper published in Nature Medicine is that the algorithm use the real world data actually have better result in detecting pain in the more underserved populations. So that brings more opportunity to how to use real world data to make our model more fair. So regulatory expert, we also have a presentation in our conference today, MHI for clinical safety and the digital interoperability, and also NICE standards. But now we need to discuss the importance of standards, especially looking at the medical device and the future blood testing kit. The standard is quite important for us to promote the innovation and also in the same time to regulate the information properly. I will finish soon. When I prepared the slides, I saw a very interesting report from Arlington Institute. So in October, so they did a quick research about how the usage of AI. Quite surprisingly to say that 1 in 4 UK doctors are using artificial intelligence. And most of them, the type of artificial intelligence is about decision support system in the imaging system, in the imaging processing and triage, and some of the generative AI, they're using GPT. And this is the key specialties they'll be using, but we have more and more special coming up with the availability of data. Most of people are optimistic about the usage of AI, but still most of people think they are not fully deployed and the opportunity hasn't been explored yet. So, and I couldn't resist myself. So you might have all seen all the news, AI wins big the novels in physics and also in the protein structure prediction. I always feel maybe in the future in the medicine with the availability of data, we might have the Nobel Prize laureate in our audience as well about our network. So using the data have new discovery from the real world data. So I've done the easiest part to raise the questions, to bring up questions, but we have a fantastic group of speakers from data, real world data, from biodata, and also from diagnostic, from regulatory aspect, and from social technical perspective, and also clinicians over the 2 days to give you more detail how what they achieved in those challenges, in addressing the challenges, and also the most advanced research around this time. And our session will be chaired by, also we are promoting the early career researchers as well. So all the sessions in the first 5 sessions will be chaired by early career researchers. And the last session will be the World of Work Institute. It will be a panel chaired by Professor Keiichi Nakata, talking about the AI and the digital technology in the health. So yeah, so that is a very quick finish now. So it's a very quick introduction, and very welcome again. And I hope you can talk to each other and connect to each other. So I believe there will be more collaboration coming up, and enjoy the next 2 days. Thank you very much.